Sciences, Prashanti Gram, will share insights on how this mission performs complex, high-risk cardiac surgeries with love as the guiding force. I invite Dr. Mulpur to talk on tertiary cardiac care, piloting the Heartspace craft.
Sairam, and welcome to Prasanthi Nilayam, the abode of the highest peace. The hospitals, what people are outlining, they are because of the benevolence of Bhagavan Sri Sathya Sai Baba. And we can be here forever, recollecting the magnitude of the service which these hospitals have provided and continue to provide. When you enter the precincts of Sri Sathya Sai Institute of Higher Medical Sciences, Prasanthi Nilayam, you are greeted by this mammoth idol of Lord Ganesha, and at the bottom it says, Paropakarardham idam seriram. The reason why you are given this body is to help others and nothing else. There is no other mission. Natvaham kamayet rajyam, na swargam na punarbhavam, kamayet dukkha taptanam praninam arti nasanam. I am not going to care for the heavens or rebirth or kingdoms. All I wish is to alleviate the pain and suffering of fellow human beings. There are quite a few doctors who have such lofty ideals. There are quite a few patients who require such loving care. But where is the platform that gets them together? I have not seen any other place other than Sri Sathya Sai Institute of Higher Medical Sciences. As you look at to the roof, you will see the unique Sarvadharma symbol which has been drawn by Bhagavan himself. And again, I have never seen a place anywhere in the world where all religions, they come here and preach and they are happy. What has it to do with our tertiary care? You will know in a minute. The fact that all religions are one, the sayings that love all, serve all, and help ever and hurt never, which those two sentences we spend our entire life, never be able to fulfill that. Hands that serve are holier than the lips that pray. Service to man is service to God, and so on. And it also says, hands in society, head in forest. You don't have special spirituality time. You do your work with your hands and always be detached and think of the very reason that is the practical spirituality. All the treatments which have been here given, rendered in these hospitals are totally free without reference to caste, color, creed, nationality, and religion. Show me one more hospital in the world which says the doors are open to anyone in the world. And we don't care what religion you practice. We don't care whether you believe in Sai Baba or not. You come here, have the treatment and go. I have not seen any hospital like this in the world. You are sitting in a grand auditorium. We could have had smaller auditoriums. And to save money, you could have had the hospitals in much smaller spaces. Sathya Sai Institute of Higher Medical Sciences, Prasanthi Nilayam, is in 104 acres. And the one in Whitefield is in 55 acres. The land value, I don't even know. This is the grand Sathya Sai Institute of Higher Medical Sciences, Prasanthi Nilayam. When the architects were drawing the plans, Swami told them, the poorest of the poor should have the comfort of Buckingham Palace. In my last days in Leeds, and when I told all my English nurses I am going back to Prasanthi Nilayam, and I showed them, they said, wow, that looks like a palace. So exactly what Swami wanted, it manifested. The departments of cardiology and cardiothoracic surgery are unique because these are the only departments which are duplicated in both hospitals, just to tell you the load what we have. Once upon a time in 2003, we did a study. The last patient who is going to be entered into system, how long does it take for him to get his call from hospital. 200 years. And from there, we have come to a stage, not just because of our work, because of the government's also pitching in. Now we are actually offering treatment real time. You come to hospital, you walk in, and you have your treatment and go. But 200 years was the calculation which I presented in IIM Ahmedabad about 25 years ago. We have got training for DNB in cardiology and cardiothoracic surgery. In cardiology, both hospitals do the entire gamut of cardiology, diagnostic cardiology, PTCS, stenting. The reason why I wanted to make sure that everyone knows about this is, on occasion, I find an office bearer of Sathya Sai Seva organizations come to me and ask, after Swami passing away, are we doing heart surgeries in our hospitals? So that's the reason why I thought it's a good reminder for the other specialists also what goes on here. So the chronic total occlusions, valvuloplasties, we had the largest number of valvuloplasties. Now, luckily, the incidence has come down. Every month, Whitefield Hospital used to do 100 PTMCs or balloon dilatations on an average, which is perhaps highest in the world. Coil embolizations, now that we have moved away from surgery, device closures wherever it is appropriate, electrophysiology, radiofrequency ablations, peripheral vascular disease, angioplasties and stenting, coarctation, endografts in a hybrid form, and hybrid coronary aortic aneurysm surgery, you name it, it is done in our hospitals. In cardiothoracic surgery, in the departments of both hospitals, we do everything. As in congenital heart surgery, we have got the ASDs, VSDs, PDA, AP windows, and I don't want to bore with the full forms. As I said, every single congenital heart surgery, whether it is curative or palliative, we are here to offer. Tumors of heart, we have one of the world's largest experiences in tumors of heart as well as in ruptured sinus of Valsalva. It has been published in peer journals. Coronary artery surgery, both off-pump and on-pump. Aortic aneurysm surgery, hybrid procedures, mediastinal tumors, lung surgery, all of them can be primary or redo. Everything is done in our hospitals. What we have not done is transplantation. And one of the central trustees now, Hira, he just went through and found that in 2001, Swami said transplantation will be performed in this. So he ignited. And just a week ago, we entered into an MOU with University of Chicago and Institute of Science Tokyo. And I'm sure in the near future, we'll have transplantation done in such size hospitals. I have no idea about the monetary value because these numbers look like Aadhaar card numbers. 140,000 cardiac procedures are performed. Now, with whatever convertibility you have, find out how much of money is it going to cost to a common man. About 60,000 open heart surgeries have been performed in these two hospitals put together. Again, when anyone comes visiting from various countries, they step into our hospital, cath labs, and the intensive care units. They are stuck with the size. These are the operation theaters, what we have in Whitefield. The intensive care units, they compete with the best in the world. In Bombay, I'm told now in hospitals, they talk about revenue per square foot of the hospital. Revenue for bed was last. Now it is revenue for square foot. So with that being the world, these are massive and gigantic. You'll never get claustrophobic. This is the cath lab in Whitefield. The operation theaters in Puttaparthi, we have 3 of them. We have 4 operation theaters in Whitefield, working 6 days a week. We don't know what is a 5-day week. This is the cath lab in Puttaparthi. The cardiac care unit in Prasanthi Nilayam. I just wanted to show you one index case. When I say we have patients from everywhere, we had patients from Pakistan, we had patients from Russia. Only a couple of months ago, we had a child. And somebody said, we want to get this child from Malawi. Thanks to Google, I quickly slipped out and found out I never knew that there is a country called Malawi. I have taken permission from the mother, and she says, please go ahead and show the photographs of my son. This is a 9-kilogram, 3-year-old boy who had 4 problems in his heart, what we call a tetralogy fellow. He was flown all free to Puttaparthi from Malawi. A car was arranged for him to be picked up. When he stayed here for 1 month, there was a car hotel accommodation for mother, and the name of the patient is Prince. He had a princely treatment, and his demands were also princely. Malawi is one of the world's poorest and least developed countries if you want to go and find out what is this country about. This is this kid, prior to surgery, always smiling. He had this operation. He is surrounded in this photograph by our angels who look after our patients. As Uma was saying, these doctors and patients are not looking at money, and they are looking at service. This is Prince asking for tea, and he is back in Malawi after the surgery. The unique freedom which is given to specialists of the hospitals, there is nobody who is going to ask you how to choose a case. You plan the treatment, you are given freedom. And after a procedure is committed, no one from Central Trust has asked us, what the hell is going on? How much are you spending? When Bhagwan was alive, to now, there is absolutely no manipulation of waiting lists of the hospitals ever. We have got national and international collaborators. They come here, they make their own travel arrangements. We just look after their stay and food. And we want to increase awareness of such opportunities for all specialists. And as I said, we have got this MOU with University of Chicago for organ transplantation and artificial hearts, and University of Tokyo. And they were very keen in improving the services both in Tokyo as well as back in India in Sathya Sai Institute of Higher Medical Sciences. Somebody asked, how long is Sai Baba going to do this free service? Swami was fed up with these questions, and one day in Hillview Stadium, he said, at least for next 1,000 years. And how is this possible? Of course, the cornerstone is benevolence of Bhagwan, Sri Sathya Sai Baba, continued support of Sri Sathya Sai Central Trust, participation of Sri Sathya Sai Global Council, which is now in 180 countries, national and international doctors who visit the hospital. Sathya Sai Seva organizations are the backbone to the hospital. And this Bhagwan himself, he said on multiple occasions, if there is no Sathya Sai Seva organizations, there is no hospital. Of course, there are donations and corpus fund. Most important, we have never empaneled or enrolled for any government scheme or reimbursement from any state or central government. Why are we doing this? We are aware that we are not here to wipe out the tears of every patient in the world. Swami was asked himself, why have you started hospitals? Summary is, these are going to serve as role models. Any one of you can send any number of patients for free treatment in this hospital. Doors are open for doctors, nurses, and other specialists to come and offer their services. And the motive of this hospital to serve as a role model, and it did indeed serve the role model part, because quite a few other hospitals in the world are now starting up. Na karmana, na prajaya dhanena, tyage naikena amrutatva manasuhu. We have to remind ourselves, it is not the wealth you get, it's not the people, it's not the positions, it is tyaga or sacrifice, and where else you will find such an opportunity. But wherever you are working, you may not be having Sathya Sai Institute of Higher Medical Sciences in your back door, but Swami said, at least you have one day in your weekly schedule and give it free to the needy and helpless, and there ends his mission. If we have motivated you to take up such activity, the purpose of this conference is served. Thank you, Sai Ram.
Thank you, Dr. Anil, for showing how precision, expertise, and compassion together power the Heartspace craft.